profession and his life and his health challenges. So my first question to you, Doctor, is where are you from originally?
I'm born and raised in this area. My parents were both from Arlington, Texas, and I've lived in this area my whole life.
And you're a chiropractor. What led you to this profession?
I was always interested in natural health care. I didn't know exactly how I wanted to approach things as I was going into college, as most people, but I had a good experience with a chiropractor growing up, and once I got into college and realized I liked the basic sciences and anatomy, I decided that my experience with previous chiropractor helping me out was something that I decided I wanted to be able to do for other people.
Did you have like a sports injury or something?
Yeah, I did. I was playing football and had really hurt my neck. And so to make a long story short, I could not look up at all. And all weekend long I was miserable. So one of my friends at school, his dad was a chiropractor, and I'd taken the over-the-counter meds all weekend, and I was still horrid when I got back to school on Monday. And I decided I'd go see my friend's dad, and it worked great. I was able to play in the game on Friday night.
So you had tried the allopathic regular doctor medicine route and it didn't work, and so you went to, for years chiropractors were viewed as total quacks by MDs, but it worked, so it definitely changed your mind about them.
Yeah, quite interesting, yes. Chiropractic is about treating the problem, not just covering the symptom with a medication.
I understand that you had a very serious health threat many years ago. Can you tell me about that?
Yeah, it was about 7 years ago. I started noticing some pain in the testicular region and ended up going to the medical doctors and trying to figure out exactly what was wrong. And it turned out that I had 2 testicular tumors on the left side. So that was quite a shock.
And what was their prognosis?
Well, the prognosis is usually pretty good for testicular tumors, but the treatment plan in all cases for men who have tumors is to have the orchiectomy, which is they chop off your testicle, which didn't sound so fun in my case. And the reason they do that is because in most cases, I don't know the percentage exactly, but most, enough to where this is the way they treat it, they take off the testicle, then look at it, and it's usually cancer. So, I can't exactly say I had cancer, but I definitely had tumors that doctors were recommending the orchiectomy for.
So what did you decide to do?
Well, I decided to take matters into my own hands at that point, because the choice was what they were offering or something else, so I chose something else, knowing that if it didn't work, I would be able to go back and have that other option. But that's when I started doing a lot of research. That's when I got into nutrition and started looking into function. And I was amazed to see that this has all already been done. I didn't discover anything. It's already out there. Nobel Peace Prizes have been awarded to medical doctors, showing that cancer cannot survive in an alkaline environment. And in an alkaline environment. And most people are acidic. And so, modern medicine just doesn't preach that, even though a medical doctor discovered this. Found out about nutrition and how powerful it can be. And, nutrition doesn't treat the tumor. Nutrition treats the person, and people are designed to heal. And I believe truly that's what's happened.
What specifically, what were some of the things that you did then to reduce your body's acid from acid to more neutral or alkaline?
Well, I changed my diet drastically. Believe it or not, everybody in the health field isn't healthy all the time, and I wasn't. I tried to work out and eat what I thought was good, but I didn't know what was good. Started doing a lot of research on whole foods, and by whole foods I mean if it grew in the ground or was alive at one point in time, it's usually pretty good. If it's been processed, that's the things you need to try to stay away from. To specifically treat the acid-alkaline levels, I went on a raw foods diet. Nothing crossed my lips but good water and raw vegetables and fruit for an entire month. And then I started incorporating some cooked vegetables and learned the wonders of spaghetti squash, and was able to start tricking myself into thinking I was eating spaghetti with that. And it is good. But slowly it took every bit of a month and a half for me to get my acid alkaline levels to where they needed to be. And then probably for another month I kept them where they needed to be on a higher pH. So above a 7, a 7.5 is about what you're looking for.
So were you doing regular urine tests?
Yeah, I was checking through urine and pH tests like that. Checking in the morning because usually you're more acidic in the mornings. And wanted to make sure that my body was not acidic and I was more on the alkaline side.
And then, so this, you mentioned that this went on for like 3 or 4 months, and you got it to a more alkaline state, and then roughly how long in that before they started seeing changes to the tumors?
Well, I treated it as this. If you're around somebody all the time, you can't really tell if they've gained a pound or 2. So I decided I'm going to give myself 2 months. I'm not going to check because the tumors were actually palpable on the testicle. I'm not going to worry about it. I'm just going to do everything that I've set out to do with the dietary changes. And it was approximately 2.5 to 3 months before I actually got back in to be reevaluated at the medical doctor's office. And they do sonograms, and that's the way they're able to determine that it is a tumor. And once they did the follow-up sonogram, I'd say approximately just over 3 months after the initial diagnosis, the follow-up sonogram quotes resolution of the previously noted mass-like lesions. So
by
impressive.
resolution, does that mean that it was gone?
Yeah, resolution. They were gone. It was one of those things. The first time I tried to actually feel for it, I was. Is it there? Am I imagining that? And it truly was. It was gone.
And what was your doctor's response?
I was in his office after having the follow-up sonogram. I didn't know the results, and I'm sitting there. He walks in, and I'm nervous, and he's like, "Well, all I can say is you must have family that prays a lot." And my answer was like, "I do, and we did," but I truly don't think that was all of it. Miracles can happen, but there was a lot of work put into this. I changed my diet drastically.
Was he even curious about what you had done?
He asked what it is that you do, and when I answered him, his response pretty much let me realize, this is what he thinks of this. I told him, what I had done, and he said, "Oh," and he turned around and took some notes. And that's when it hit me. It was like, okay, let me put myself in his shoes. I'm a surgeon. I can do a surgery that may take an hour, probably not even that long, and get paid thousands upon thousands of dollars. Or I can talk to patients and interest them in diet and nutrition and make several hundred to $1,000 spending multiple visits with this patient. Which one might I be more likely to recommend?
Yeah.
So there's always a monetary issue to everything, and sometimes that can get in the way of things.
Now, one of the reasons I'm asking you some of this stuff in my new book that's out, Just Do This One Thing, I talk quite a bit about body acid, pH balance, inflammation, and so forth. And obviously what happened to you predates my book, but in your reading through my book, were a lot of the steps that I talk about in the book the same things that you did?
A lot of it, yes. It was something that I haven't even mentioned to you yet, but there's really only one truth. And when I was reading your book, I was like, this is everything that I've already looked at. This is what I found. And again, it's like I said earlier, the research is already out there. People have done this, but it's unfortunate that it's not being used on a more widespread basis today.
Well, we know that cancer is a $1 trillion a year industry, and it doesn't appear that anyone at any level wants to change that. So, now I also understand that not too long ago your father was dealt a rather difficult blow. Can you talk about that too?
He was diagnosed, it's been about 5 years now, I guess, but with chronic leukemia. And, thank goodness he was at his medical doctor's office and they were able to catch it, and they were able to catch it quite early. and even per his own MD, said, well, you have no symptoms, there's no reason to start treatment, because the only treatment would be the radiation and chemo that they would do. He's like, so come back and see me when you're worse. And this wasn't long at all after we had done what I had done for my health issue, and I told him, I was like, Dad, you have to do this. And then, of course, I gave him the guilt trip. I was like, you've got me, you've got your grandkids, you know?
Yeah.
So he's made some impressive changes too. And today, 5 years later, his white blood cell count is almost normal. It's better than it was 5 years ago. And so by making the changes, he didn't go away and get worse. He's actually in that process of healing. So.
And does his doctor have any comments about it?
He hasn't really been back to the medical doctor on this because he has no symptoms, and that's really the difference. You know, the medical world is concerned with your symptoms, and all too often, if they can give you a pill to fix what it is you've come in to complain about, well, then they've done their job. And more of the holistic approach is to listen to the patient and listen to their symptoms, but understand, you know what? Those might only be symptoms of an underlying condition. Yeah. So, yeah. What does my mom think? When I was going through what I went through and making the decision to not do what was recommended by the medical world, I got some resistance, as most people would, from their family. My wife wasn't real happy when I first told her. I had a 1-year-old at the time. My mother-in-law's a nurse. My mom is a pharmaceutical tech working in a, what are those places called that hand out meds? I don't use them very often. And one of the things my mom said to me was, and she wasn't trying to be mean, this was a heartfelt conversation. My mom said to me, I can't believe you're so brainwashed. And kind of took me back a little bit, but I was kind of proud of my immediate response. I was like, Mom, who here is brainwashed? Who is the one that thinks it has to be done one way? I'm like, my way does offer a follow-up. If my way doesn't work, there is the chance to go back and have the surgery. So, looking back on it now, of course, Mom could only be happy because all a mom ever wants is health for their children. But there's more than one way to health.
Yes. What would you like my audience to know about allopathic versus holistic medicine?
Well, I think we hit on that just a minute ago, but allopathy is very symptom-based. If they can suppress your symptoms, whatever it is, be it a cough or a rash, and let's use the rash for an example. One of the first symptoms that people can experience of the disease lupus is a butterfly rash that you get across your cheeks and your nose. And, you know, of course it could be diagnosed by the medical world, I'm not saying that, but many times the MDs would be like, oh, well, you're coming in complaining of a rash. Well, here's a corticosteroid cream, let's go rub that on your face. And then the rash is gone, so the patient thinks they're better. That's just not okay in our book, because that underlying condition, the disease lupus, is what was causing that, and you're just suppressing its symptoms, and the disease continues to progress and continues to get worse. And is that patient healthier because the rash is gone? Absolutely not. So a holistic doctor would identify what the patient's complaining of as the problem, not the symptom, and be like, I understand you have a rash, but I don't care about your face. Let's worry about the disease lupus and the treatments that can be done to help with the immune system and your spleen, and start getting your body working the way that it should.
It's an interesting example because I mentioned in my book about, and I mentioned lupus specifically, that it seems to be heavily tied into your gut, which other skin diseases are tied into your gut too, such as rosacea, acne, psoriasis, eczema, and you treat the gut, make it healthy, and a lot of these other autoimmune and skin problems go away.
It's very true.
You know, we touched on before that difficulty with your doctor accepting that what you did actually worked, and I found this to be true. They tend to talk about, well, that they want to say they're dealing with science and that you're not somehow. But yet when confronted with a success story, they switch to miracle like prayer, and there's nothing in between. I know that a friend of mine had trouble dealing with my success story, so he attributed it to that I willed myself well. He just couldn't handle that maybe there was something to a holistic approach. So again, he went to an extreme that my mind just healed myself. And I don't deny that a positive attitude makes a big difference in healing, but I just found that interesting that he as well couldn't see that maybe there was some other process going on. I noticed in your office you have different signs on the wall. It's like regarding fish oil and so forth. Mm-hmm. What 3 things would you especially encourage people to become healthier?
Well, one of my mentors is James Chestnut. He's done a lot of research. He's a chiropractor. He's a scientist. He does a lot of science-based work. And he's written books, and I'm going to steal from him. One of his mottos is eat well, move well, think well. And that encompasses so much. But the eat well side has to do with the easiest way to put that is if your body is toxic from the things you're putting into it, you can't be healthy. If your body is deficient because you're not putting in the things that you absolutely have to have in order to be healthy, you can't be healthy. So those are the things that we identify here in our office. And I usually look at the deficiencies first because I truly believe a body that has everything that it needs in order to be healthy can handle a donut occasionally. But if you're feeding your kids donuts and you're not giving them that nutrition, you're just asking for future problems. There's got to be that, the nutrition in order to build the body that needs to be healthy. The move well. There's so much science behind the hormones that can be produced in movement and exercise. A lot of that science shows that it's specifically movement of the axial skeleton, which is the spine, that produces most of those hormones. And those hormones are basically the hormones that fight against the hormones that stress produces. So I tell a lot of my patients, well, I don't recommend all of my patients exercise, only the ones that have 0 stress in their lives, don't need to exercise. So stress produces these hormones, and these hormones are going to cause chronic health issues. Exercise, specifically movement of the spine, produces these hormones that act as a balance between the stress hormones. And so exercise is vital. And I feel that that's where chiropractic comes in, because if the axial skeleton is what produces most, movement of the axial skeleton produces most of those hormones, what if the skeleton isn't moving the way that it should when you're doing those exercises? That's where chiropractic comes in. And then the think well side of it has a lot to do with what you've put in your book. The positive attitude, the person who, what I tell my patients, if you get cut off in traffic and you're just like, I got cut off there, or you're like, God, I'm glad I just got cut off. It could have been worse. Which person's probably going to be healthier?
Yeah.
So that attitude plays a huge role. Eat well, move well, think well. So once my mom saw the results that happened with me, she was on board with my dad giving it a try. She was able to realize, there is something to this. And we almost expected results with my dad. Now, granted, my dad's results have been nowhere near as fast as mine, because one of the signs in my office is the power that made the body heals the body. And I truly believe the body has that ability to heal, but there's always a limit. And my dad's leukemia may have been a little bit worse at the point that we caught it than my tumor was. I responded much faster. I think the age difference has something to do with it. I also think the discipline has something to do with it. I think those 2.5 months, I was perfect. I didn't mess up. I didn't do anything wrong. And my dad has made major changes, but he still does some things he might not need to be doing.
Like a Dr. Pepper now and then?
Like a Dr. Pepper, yeah.
Well, anyway, Dr. Edwards, thank you so much for doing this interview with me and for my audience, and just wish you all watching this good health, and I hope you all realize that no matter what a doctor tells you, you always have options, but you've got to take responsibility for your health yourself.